What is IVF? In today's video, I'll be talking about in vitro fertilization (IVF), which is the most common and effective fertility treatment available. It involves combining an egg and sperm outside the body in a laboratory to help people that are finding it difficult conceiving. How does this IVF work? The first step is ovarian stimulation. In this first stage, the patient, usually the female partner, takes medications to stimulate the ovaries to produce multiple eggs that can be used. Normally, only one egg is released during a cycle, but with IVF, we aim at collecting several eggs to increase your chances of a fertilization. So no need of collecting only one egg, which might not increase the chances. Common question: why do I need more than one egg? More eggs increases your chances of finding healthy eggs that can lead to a successful pregnancy. You cannot just pay a huge sum and still collect only one egg. It might fail. The next stage is egg retrieval. Once the eggs are ready, a minor surgical procedure called the egg retrieval is performed. The doctor uses a thin needle to collect eggs from the ovaries of the patient under sedation. This process is usually painless. Common question: is egg retrieval painful? Most people experience mild discomfort, but the procedure itself is done under sedation, so you won't feel any pain. So this procedure is not painful under anesthesia or sedation. Step 3. Fertilization. In the lab, the collected eggs are combined with a sperm from the partner or a donor. There are two main methods that we use for fertilization. The first method, which is used for fertilization, is traditional IVF, which means that sperm is mixed with the egg in a dish and allowed to fertilize on their own or naturally. While the second method is intracystoplasmic sperm injection, this is a single sperm is directly injected into the egg for fertilization. Step 4. Embryo development. After fertilization, the egg develops into an embryo over the next few days. The embryologist monitors the growth of these embryos, selecting the healthiest ones for pregnancy. Common question: what if my embryo doesn't develop properly? Not all embryos will develop into a viable pregnancy, which is why multiple eggs is collected from the start to help you improve your chances of these eggs becoming a successful embryo. Step 5. Embryo transfer. Once the embryo are ready, one or more are transferred directly into the uterus using a thin catheter. This is a quick and a simple procedure, often described as a type of pap smear. Common question: how many embryos are usually transferred? Usually 1 or 2 embryos are transferred to reduce the risk of multiple pregnancies, but doctor will discuss this based on your scientific case. Step 6. Pregnancy test. After the embryo transfer, you will wait for at least 10 to 14 days, that is 2 weeks, before taking a pregnancy test to determine if this procedure is successful. Common questions: what happens if the IVF cycle isn't successful? Not all IVF cycle is successful and can lead to pregnancy. If the first attempt isn't successful, there are options for trying again with frozen embryos for the next cycle. So let's address some misconceptions concerning IVF. IVF is only for older women. No, IVF can help people of various ages and situations, those with fertility issues of all ages. The next misconception is IVF guarantees pregnancy. No. While IVF improves your chances of conception, it doesn't guarantee the success. So the success rate might vary based on factors like your age and your overall health. So it is not a sign of success. IVF is a complex but effective process that can help you or anyone trying to achieve their dream of starting a family. Whether you are exploring your fertility options or learning more, understanding the steps can help you work better. And always consult your fertility specialist for a proper diagnosis and treatment options. Don't do it on your own. See you in my next video. Bye.